4th and Wednesday, and I, again, very regretfully have to start off and tell you that we've, since Monday, we've lost another 14 great West Virginians. You know, I know yesterday was election day, and we went through all that and everything, but if you'll just dial back and just absolutely just think, you know, another 14 West Virginians gone. Our 459th death is an 86-year-old male from Wood County. Our 460th death, an 89-year-old male from Wood County. Our 461st death, a 62-year-old male from Harrison County. Our 462nd death, an 81-year-old male from Barber County. Our 463rd death, a 63-year-old female from Wetzel County. Our 464th death, a 91-year-old female from Randolph County. Our 465th death, an 83-year-old female from Cabell County. Our 466th death is an 81-year-old male from Jefferson County. Our 467th death, an 80-year-old female from Jefferson County. Our 468th death, a 76-year-old female from Jefferson County. Our 469th death, a 79-year-old male from Jefferson County. Our 470th death, a 96-year-old female from Brooke County. Our 471st death, a 79-year-old male from Cabell County. And our 472nd death, an 87-year-old female from Cabell County. I guess I wasn't wired up. I hope everybody could hear that and everything. And did we all get all that and everything? Again, just look at the ages. The youngest of all, a 62-year-old male from Harrison County, with the eldest being a 96-year-old female from Brooke County, I'm sorry. Whew. You know, I just hate it. I hate it like crazy. You see what's going on all across this nation. It's bad, and we're dealing with it everywhere. We keep telling everybody over and over and over to, you know, no time to panic. It's not a time to be afraid, but it's a time to be really concerned. This is an absolute killer, and we have got to stay on our toes. We've got to wear a mask. I mean, how big a deal is this when it really, really gets right down to it? If this right here could save a life, how big a deal is wearing this mask? It's not much. The other thing is we have got to stay on our toes as far as keeping apart, social distancing, washing your hands, doing the things that we've told you over and over. We've got to be special careful with our elderly. I mean, you look at this list, there's 14 of them, and they range from 62, 63, everybody else is in the 70s, 80s, and 90s. This is an absolute killer, and it's taken great West Virginians away from us. It's taking the wisdom that they've given us over and over. Please don't let them become a number. We pray for their family, all their loved ones, their friends, and them in every way. Please continue to do just that. The numbers for today, yesterday, in the last 24 hours, we had 394 positive cases. That's probably due from the fact that we're testing more and more and more. Our daily positivity rate is at 4.88. That's way, way, way too high. Our cumulative positivity rate is at 2.97. Our active cases are at 5,663, and our recovered cases are right under 20,000. We have 269 patients that are hospitalized now. I think that's down to a 3 or 4 or 5, something like that. Our reproduction rate, RT rate, is at 1.09. That's the 18th best in the entire nation. We have 2 counties now that are in the red, Mineral and Mingo. We have 9 counties in the orange. That's Ohio, Marshall, Berkeley, Jefferson, Hampshire, Tyler, Wood, Jackson, and Putnam County. Now, if I could just stay with this just one second. You know, we've learned a lot about this disease, and I'm sure there's going to be questions as we go. You know, well, what are we going to do if the positivity rate reaches 3%? Well, if you'll look at the surrounding states and you'll look across this nation and everything, states are dealing with positivity rates off the chart, very, very much higher than that. You know, that's not going to be a showstopper, but at the same time, we're very concerned about that. You know, you look at the number of counties that are in the orange and the red, and I, of all people, being a coach, know that you're dealing with state tournaments and everything else, and kids that are innocent maybe as they could possibly be. And what are you going to do? What are you going to do? I mean, can they play? Can they not play? Well, really and truly, let me just say this. You know, go back to my decision, and my decision was with the state basketball tournament. My team had a real shot to win the state championship. And absolutely, we were going to play at like 7 o'clock that evening, the very evening that we canceled the state basketball tournament. I know, of all people, knows what those kids are going through or had to go through, and what your kids are going through today. Now, the reality is just really simple. Those kids and your kids have to understand we're dealing with an absolute killer, and we're trying with all in us to do everything we possibly can to stop it. Now, first and foremost, we need to be in school. You know, sports have got to take a back seat to being in school. I get it, and I know how much these kids work and how hard the coaches work, and I get every single bit of it. But at the same time, we have all got to understand these times are so unique, and absolutely we have got to do everything in our power that we possibly can to stop this thing. You know, the only thing that I can offer up is just one thing. And that is just this. The more we test, the better off we'll be. You know, I've been watching some of the test sites. Some of the test sites, still, there's not many that show up. I come on 3 days a week and plead with you and plead with you and plead with you to go get tested. Or coaches or schools or, you know, or superintendents or teachers, anybody. Encourage people. The media encourage people for them to go get tested, and yet we're still not doing it to the levels that we need to be doing it. We've made an incredible, you know, financial pledge to be able to do the testing. We have absolutely have the National Guard, the DHHR, and the health departments running themselves ragged to be able to do the testing. We've just got to show up. That's all there is to it. So it's a real difficult thing, and it's a big time sacrifice for kids that, you know, feel like, well, what in the world did I do wrong? Well, you haven't done anything wrong, but the reality is we're dealing with something here and just trying to do the very best we can to get through it. Again, I mentioned the free testing, and you know, it should be up on our website right there, and you can go, well, it's all over the place. Same way as the drive-through pharmacy stuff, we thank them for giving us that ability, and that's everywhere as well. You know, I've already gone through and encouraged you to get out and get tested. We're not doing it to the level that we need to do. From our school outbreaks, we have 79 confirmed cases in our schools. I think that's down. We have 18 outbreaks of the 79 with 79 confirmed cases. We have 55 outbreaks in our long-term care facilities. We have 14 outbreaks in our churches in 12 counties. I always read these. That's Cabell, Doddridge, Kanawha, Lewis, Mingo, Monroe, Raleigh, Ritchie, Tyler, Wayne, Wetzel, and Wood counties. Again, we know that the churches are an absolute source at times where this thing can get really bad really quickly. So remember what I say over and over. Put a pew in between you. Wear your mask. Absolutely do all the protocol from the standpoint of washing your hands and on and on and on. It's really important that you do that and think real hard about should you just miss some church services and get your services online or whatever it may be, because especially if you're an elderly person. We have no active inmate cases in corrections. We have 18 active staff cases. Our flu vaccines are offered up everywhere. I've encouraged you to go get your flu shot and everything. It'll only help you. We have $170,250,000 that have been awarded to our cities and our counties. We're going to continue that and everything. We want you to continue to apply. We'll try to get you approved as fast as we possibly can, and we'll get those monies out the door to you. And I know they've been an incredible benefit, and we want to continue for that to just happen. In our dollars that have gone out, our $25 million of CARES dollars that we set aside to go out for our public utilities, all that's in motion. And we encourage anyone that has a utility bill, on electricity, natural gas, water, and sewer from March 1 to July 31st, a delinquent bill. We are absolutely encouraging you to get in touch with whomever, and if you can't get in touch with somebody in the public service arena and you need to get in touch with our office to help you, we stand ready to try to help you to get this paid and to get this cleaned up and everything and take a whole lot of stress off of you. Now, let me just say this, and then I'll go on forward. But you honored me beyond belief yesterday, with the election, and I appreciate it with all my soul. And I'll continue to try to do any and everything I can to help each and every West Virginian in every way. I was asked last night an interesting question, from the media, and the media came up to me and said, now that the election's over, are you going to handle your briefings or handle the pandemic? How are you going to handle the pandemic differently? And I said, I'm not. You see, at the end of the day, with me, there's not been one thread of politics in handling this pandemic. I don't want it to be that way. In fact, I get really irritated when people try to throw in some level of politics, and we had some of that going on. But at the end of the day, what we need to focus on more than anything in the world with this pandemic is the simple fact that we've had 472 great West Virginians die. We're the oldest state. We're the state that's with the most chronic illnesses. And if we don't watch out, this could get way worse than it already is. Now, West Virginians, you've done really, really great. I'm going to stand steadfast with you. We don't need any politics in this. We don't need any grandstanding in this. What we need in this is results. My dad would say, don't confuse effort with accomplishment. We absolutely need to accomplish here. And the accomplishment is just this, is if we can use our mask and the power that we already have right now to let that be our vaccine until we get a vaccine. And as soon as we get that vaccine, we hope and pray that we'll only lose not many from this point forward, We don't want to lose one, but absolutely we know the reality is we're probably going to continue to lose West Virginians. So in that, if we can just minimize it as best we possibly can until we get to that vaccine, that'll be a real day of celebration. So, but we got a ways to go, West Virginia. You know, really, really tighten up. Help me in every way. Go get tested, wear your mask. Absolutely help me in every way that you possibly can. Now I'll go over the chart real quick and then I'm done. If Jordan, if you could throw that up here, you'll see that we continue to widen, and from the standpoint of our active cases and our recovered, you know, that looks a little bit okay. If you look at our daily, you know, positivity number and everything, if you look at how that's just bounced along up and down, up and down, and up and down that trend line, it's not super horrible. In fact, if you were in other states, you would give anything to have this, but we know we can do better than that. And if you look at our cumulative, which is all added together, our positivity rate continues to climb just a little teeny bit above that dotted line and everything, and we don't want that. We just don't want that. How do we get it down? How do we get it down? Well, I'll tell you how you get it down. You test, you wear your mask, you do everything in your power to protect the elderly around you. How do you get it down? It's as simple as that. It's just as simple as mud. But we got to really step it up, West Virginia. You know, it hasn't really even gotten really bad cold yet, has it? Now, I know there's a couple days when the wind blew like crazy and it was cold, and I get all that and everything. But West Virginia, you know what we're in store for. And when it gets bad outside and you don't have your flu shot or whatever it may be, you're going to get together in family settings for Thanksgiving or whatever it may be. We don't have a vaccine yet, and this thing is going to jump on us even more. And you know what, West Virginia? If you don't listen, you're going to be faced with a funeral of a loved one. And absolutely, we don't want that. It'll rip your heart out. Try with all in you. That's all we can possibly do. A bunch of prayers and everything, and we'll get through it. Anyway, thank you so much.
Thank you, Governor. First today, let's go to Dr. Clay Marsh, our coronavirus czar.
Well, good afternoon. It's wonderful to be with you today. And I want to congratulate the governor, not only on the re-election, but also for the leadership that he has displayed, and certainly the leadership team that has been engaged through this COVID pandemic. It's been a lot of extraordinary work by extraordinary people. I'm not going to say much today because the governor really did communicate what I wanted to point out to folks out there today. But the one thing I do want to remind people of is that we created this map with the colors of this map, not necessarily to try to limit or to open schools or to try to limit or open sports games or different activities. We really tried to design this to be an interactive map that was a map that could incentivize communities that were seeing more spread from COVID-19 to very aggressively try to reduce that spread. And as the governor said, you know, with the almost repeated issues that we talk about a lot, that we know that 50 to 75% of COVID-19 is communicated by people that don't know they have the disease. They don't have symptoms. They are immediately before their symptoms in that 2-day period to the day of symptoms, or they are asymptomatic. And we know that there's a group of these people, small group, 5% to 10%, who can spread to 80% of other people. And those people have been called super spreaders, but really they are able to aerosolize, to create the very fine droplets better than other people. And they are oftentimes in environments where they're speaking loudly, they're singing, they're coughing, they're yelling, they're breathing hard. And those settings where you don't have masks are settings where people can spread. And also big crowded events where people are around each other for prolonged periods of time. So what we have really tried to do, and what we would ask each citizen to think about today at this very historic time in our country and in our state, is to understand that we do have the power to change that future for ourselves. And we're seeing more counties today in red and orange and gold than we saw in the past few months. We are seeing across the country that more people are being found to be COVID positive, 92,000 people yesterday. And as we look, we're seeing West Virginians die of this. So as we look at these types of tools like the map and follow the governor's directives, it's really important for us not to see that the tools that we're using are not meant to create a reduction of personal liberties, but in fact, they're meant to create a visual and a call to arms so that each citizen who lives in each county, whether that county is red, orange, gold, yellow, or green, understands that it is a personal responsibility and a personal opportunity for you to be able to protect the people that you love. And with that, if we do that effectively, we can shut down the spread of COVID-19, as we've seen in Asian countries that have a fraction of the number of cases. In Taiwan, I believe that they have less than 600 total cases and less than, I think, 10 deaths. I think they have 5 deaths since the beginning of COVID-19. And that's an island of 23 million people. So it is within our power. In West Virginia, you've answered the call every time we've asked. And it's really important today with the cold weather coming up, the indoor environment, the rapid spread of COVID-19, that we embrace this opportunity and show what West Virginia is really about. So thank you.
All right, thank you, Dr. Marsh. Next to Major General Hoyer with the West Virginia National Guard.
Good afternoon. As Governor pointed out, we have a significant amount of testing going on. We are covering testing in 19 counties, 46 different test lanes throughout 19 counties. We've got 86 National Guard personnel involved with DHHR, local health departments, and others in that initiative. Just to give you some perspective, Commissioner Mullins on our briefing this morning pointed out that we are testing at 4.6 individuals per 1,000, which puts us at right at the best in our region. But as the governor pointed out, that still is not enough to get our numbers where we need to be. We need to be at about 7 per 1,000 to get to those numbers. So we ask that you continue to go out and get tested. In addition, we have sanitization missions going on today in multiple locations. And it was pointed out also this morning by Dr. Deb Keister from Marshall University, who is our lead liaison to our local health departments, that DHHR National Guard were initially supporting 25 of the 49 health departments. We'd had a request for 15 more. We filled 10 of those and are filling the final 5 over the next couple of days. So as was pointed out by the governor, significant amount of effort going on to support our local counties, our local health departments, and to work the testing. So again, I would ask on behalf of all the people on the front lines, healthcare workers, National Guard, first responders, please wear your mask, go out and get tested, help us bend this curve back and get our state back to where we need to be. Thank you.
Thank you, General. Next to Bill Crouch, Secretary of the West Virginia DHHR.
Good afternoon, everyone. I would like to provide a correction to the testing schedule for Marion County, West Virginia. Please note that Marion County, the testing event that was announced for today will actually be held tomorrow. I apologize for that. That was an error as it came through the system. The date was wrong. The good news is that will take place tomorrow from 12 p.m. to 3 p.m. at the Marion County Health Department, and that's at 300 2nd Street in Fairmont. So again, I apologize for that error, but the testing will be held tomorrow from 12 p.m. to 3 p.m. I want to reiterate what the governor said with regarding testing and encourage all West Virginians to take advantage of our free COVID-19 testing events across the state. Those are increasing significantly in terms of numbers. Through our partnership with the National Guard, there are many ways for West Virginians to access COVID-19 testing. Our local health departments have been working around the clock to increase these numbers and offer free testing events across the state. I want to thank all of our health departments for stepping up. They're taking on an incredible load during a time when everyone is exhausted. Some health departments have added routine, reoccurring weekly testing events at their facilities. And again, our health departments have stepped up and are helping in a great way to fight this disease as our partners in this. They are our frontline folks that are boots on the ground, and they're heroes in our communities in West Virginia. So I sincerely thank them for their help. As we've also discussed, we have testing events scheduled through partnerships with Walgreens and Fruth pharmacies. All of this testing information can be found on our website at www.coronavirus.wv.gov. And this website, by the way, is updated daily as testing events are scheduled throughout the day. So thank you.
All right, thank you, Secretary. Next and last today, we'll go to Dr. Amjad, our State Health Officer.
Good afternoon. I also want to congratulate the governor on his reelection for the next 4 years and his leadership from the start of COVID-19 pandemic. And I also wanted to just give a little brief update. We do have some services for anyone who's suffering from depression during the COVID-19 pandemic. The DHHR does have a Bureau for Behavioral Health that offers first choice services through a Help 304 network. The website is help304.com. And they do have a meeting tonight that is at 6 p.m. It's a Zoom meeting, and you can go on the website for that. And it's, again, help304.com, or you can call it at 877-HELP-304. And you don't need a referral. Anyone can join it. But the American Psychiatric Association did do a survey, and about 36% of people do report some type of depression or anxiety due to COVID-19. And about 59% of people are also reporting that COVID-19 has been affecting their day-to-day life. So we do encourage people to visit this website or try to attend these meetings. They will be having them weekly. And we, as mentioned several times, even on our briefings, people are suffering from depression due to loneliness and due to the stress of COVID-19. So we do thank the Bureau for Behavioral Health for offering this. Again, it's first choice services, and we will have those available and even on our website again. Thank you.
All right, thank you, Dr. Amjad. We'll now go to questions from members of the media. The first today from Kenny Bass with WCHS and Fox 11.
Thank you. This is Kenny Bass with Channel 8 and Fox 11. Congratulations, Governor, for your win last night in the election. I have a question about the utility payments. I've been contacted by several people, and I don't know their individual situations because I didn't travel out to talk with them or check with the utilities. But they're sharing that they're very desperate because they failed to pay utilities when the pandemic started because they were unemployed or out of work or at other circumstances. And so we went all through the summer where they didn't pay bills. And now that utilities are allowed to do cutoffs, they're waiting for that $25 million to start flowing toward them. Can you get any more specific about when that money will actually start moving? Has it already? Should people just be patient? Because there's a lot of concern from the people that I've talked to that they're going to lose water or electric service, et cetera. Thank you.
Kenny, I don't know that I've got every specific, but it should be available right now. You know, I don't, you know, that's not come back to us and everything, you know, but I'll double check it and everything. But you know me, I'm an impatient guy, that's for sure. And if we've got people out there that are helping, we've sure dedicated the funds, and it ought to be going out. and it ought to be going out right now. And so, you know, I'll just have to follow up and check on it.
All right, thank you, Kenny. Next.
Jordan, let me say this. You know, Kenny, this flows, I think it flows to the utilities. It does not flow to the customers. It flows directly on their behalf to the utilities. I think that's the way it's supposed to work, but I'll follow up and check on that too.
All right, thank you, Kenny. Next, we'll go to Paul Mullen with WCBC.
Good afternoon, Governor. Congratulations. Good afternoon, panel. I want to go back to something that Dr. Marsh said about the 2 days prior to symptoms and the asymptomatic, and a potential gap there in people going to be tested. I'm in a situation now where I am self-isolating because I heard one of my friends that I had been exposed to may have been exposed to the virus. I thought that was the best way forward because by the time all the testing had done, I could have exposed other people that were in an at-risk situation or in a situation that they're an older person and they may catch the disease as well. Is there a way to close that gap? Am I doing it the right way, or am I being paranoid?
Well, David, I'd say you're doing it in a very honorable way, but I'm going to let Dr. Marsh and Dr. Amjad, you know, step in and talk more, you know, on a professional basis. But the very thing what you just said is you said, I'm afraid of the possibility of giving this to someone that's an elderly person or whatever like that, and then us losing them. You know, I don't know how it gets any more honorable, but thank you so much for what you're already doing. And Dr. Marsh and Dr. Amjad, please join in and follow up on that, please.
Thank you, Governor. And I'll start if that's okay, and then you can add in. So, Paul, thank you for your question. Certainly, as we look at close contacts to people that test COVID positive, then those people are identified by the local health departments and contacted. If you are a contact of somebody who may have been a contact, then that secondary contact may not get that same call from the local health department. And I think that being conservative, being careful as you're doing, if that can fit into your lifestyle, is a good idea. Certainly when, as we've said before, when we look at transmission between, you know, people with the disease, only it looks like a small group of people are really responsible for a large amount of the transmission, the 5 to 10% of people who infect 80% of others are the, you know, quote unquote super spreaders. I don't want to stigmatize people. That's just the name that's been used. And if you look at household contacts, it's generally been pretty low, 9 to 17% transmission in households. I think that the real key question that you bring up, which is a super important one, is because we can't absolutely know who is infected with COVID-19, and we want to protect everybody, that is the reason why masks and physical distancing are so important, because masks really reduce the droplet or the aerosols that you're generating if you happen to be somebody who is infected and doesn't know it and is around other people. And it also is the reason why we really tell people to avoid crowds as much as possible, closed indoor environments, particularly those environments where people are going to take off their masks. And we've seen transmission in restaurants, we've seen it in bars, coffee shops, gymnasiums, and also try not to stay around somebody who you don't live with. And the current CDC guidelines are a total of 15 minutes cumulatively within a 24-hour period of time. And the mask and the physical distancing really do reduce markedly any risk of transmission during that time. So, Aina, I don't know if you have other things you would like to add.
I don't, Paul, but just agree with what Clay said, so I don't. Thank you, though.
Jordan, come back to me. Just want to say, Paul, I apologize. I thought it was David, and I should have recognized your voice, but Paul, forgive me again. Thank you so much.
All right, thank you, Paul. Next to Charles Young with WV News.
Hi, this is Charles Young with WV News. Governor, I wanted to go back to what you said about us approaching the 3% cumulative rate. I know you said in the past that this is something we're keeping our eye on, that number is pretty slow to move, but we're getting towards that 3% benchmark. Can you say specifically what that'll mean, what will happen when we do hit that number? Thank you.
Charles, I don't think I can say specifically because we're watching it and everything. We don't want to be at 3%. I get that and everything, but from the standpoint of pulling the plug and starting to shut things down, we're not going to do that. We don't feel that would be, that benchmark is a benchmark that would warrant doing that. But from the standpoint of watching it, we're watching it really close. I don't know exactly what actions we'll take, but we sure want it to come down, and we're again, like I said over and over, we're just watching it. We're watching it. Our neighboring states are, for the most part, probably all significantly higher than us, and we all know the repercussions of what a shutdown would entail, and what a shutdown would cost, and what a shutdown would weigh on everybody, and all that. We don't want any part of that if we can avoid it. But we remember, this is just a benchmark. This is not a line in the sand, or it's not a national guideline or whatever like that. It's just a benchmark right now. But we want it to be under that. That's for sure.
All right, thank you, Charles. Next to Phil Kabler with the Charleston Gazette-Mail.
Hello, everyone. Congratulations, Governor, on your reelection. As we mentioned, we're approaching the 3% cumulative, and Harvard Global today on their risk map has 45 of 55 counties, either red or orange, for high risk of spread of the virus. Should we be taking more stringent steps, since it appears we're trending in the wrong direction as far as containment of the virus?
Well, Phil, I do not think we need to take any more stringent steps at this point in time, but I do want to say that, first and foremost, it's all still on the table. I don't think any of us need to sit back here and say, we're not going to do this, we're not going to do that. Phil, we're watching it all. I am completely dialed into our health community. I listen to these experts, and right now, as compared to the other states, this situation is going on all across our nation, and it's bad. It's bad all across our nation. It's far worse than it is here. I do not think we need to move more aggressively towards shutdowns and things like that at this point in time, but Phil, that's got to always stay on the table and everything in an effort to try to protect us. And I appreciate your kind words about the governorship, but we're watching it, and we're going to continue to do just that.
All right, thank you, Phil. Next to Brittany Patterson with West Virginia Public Broadcasting.
Hi, Governor. Hi, panel. Thank you for taking my question. So this is for the governor. Earlier this morning, the president prematurely declared victory and falsely alleged that there was fraud in the election and indicated he might attempt to stop the count of ballots. As the head and the top official here in West Virginia, Governor, what is your reaction to the president's statement, and do you believe what Trump has said about fraud in this election? Thank you.
Well, I didn't see it, and I heard, people. I heard people, were saying, well, I wish he wouldn't have said that, and then others saying, well, I understand how upset he is and all that. Listen, let me just say this. I'm not Donald Trump. I'm not Donald Trump. I'm Donald Trump's friend, and I think he's done a heck of a job. And there's times when Donald Trump's personality is Donald Trump's personality. but he led this nation in so many different ways, and it's a tough, tough job. And he had lots and lots of people shooting at him all the time. Now, really and truly, what we need to be doing right now is saying prayers for our leaders and our president and everything in every way. Now, when it really boils right down to it, let's again be brutally honest. A lot of these mail-in ballots and everything, you know, not verifying signatures and everything, whether they are or they aren't is not an argument for me. Whether it could be an invitation for fraud. It can be. And I mean, that's all there is to it. And the likelihood of it being that is probably fairly high in some places. Just think about this. From the standpoint of our unemployment checks, the checks going out to the very people that were hurting and hurting really, really badly. What happened to us? I mean, what happened all across this nation? You have scam artists and everything else that are trying to beat the system in every way. We had fraud upon fraud that we kind of caught. I'll promise you that there was people that got checks in a fraudulently way that absolutely we didn't catch. There's no way we could have caught them all, you know, and in all this, you know, there's probably an absolute, you know, we could step back and say, dag, you know, here's a guy that worked really hard, sacrificed an awful lot for us, you know, as a nation, and did an incredible job in many, many, many different areas. And really, I mean, if he's frustrated about something that is extremely likely, we don't need to attack his personality. I mean, his personality is his personality. And so I didn't see it, and I wouldn't have said it, but at the same time, I'm not Donald Trump, and Donald Trump's not Jim Justice. And so we are all different. God made us that way, thank goodness, and so we continue to move forward. And but I do understand completely his comments, and I absolutely believe with all in me that there is fraudulent activity because it is just too ripe an invitation for it not to be. It had to be. You know, that's all there is to it. You know, I wish to goodness we could have all gone to the polls and voted, but I do understand too that you got people that are afraid. They're afraid. We're dealing with a pandemic. I get it. And they want to vote and vote from home and everything else. I get every bit of that. Like I said, tough balancing act. But I think first and foremost that prayer, rather than attack somebody's personality and everything, is the best way to go.
All right, thank you, Brittany. Governor, I'll turn it back to you.
Well, the only thing I would say is just a couple things really fast. I hope to goodness that Secretary Crouch has left the building if the fire alarm was going on in his office or in his building there and everything. And I don't say that with a whole lot of humor. I apologize to Paul for calling him David, you know, and the other thing I would say is just this, is our great General Hoyer just said to us that I think he said this, that we are testing in 19 counties. We are testing at 46 sites in 19 counties. We are also doing sanitization, you know, practices all over the place. And that's just the DNR. I mean, that's just the National Guard and the health departments and the DHHR, and all those people are absolutely out there on the front line working their ever-loving tail off. And from the standpoint of me, I said, put the money in it. We've got to do it. We've got to do it. And I instructed our general to go and go right now. Now, listen, West Virginians, you know, I am a straight talking guy, and I don't blow smoke at any of you. I am telling you, you have got to go get tested. These people's sacrifice, the monetary sacrifice, is unbelievable when we say we're going to put it out there and put it out there available to you. You got to go get tested. You got to go get tested. You can save a life. Just like Paul stepping up in his own little way there. You can save a life. Absolutely. Now, come on. We got to go get tested. anyway, that's all I got today, and thank everybody, and thank all the people that are on the call, all the media, thank everybody, and let's just all keep pulling this rope together. We don't need to be Republicans, Democrats, Independents. We don't need to be the news media and the politicians or the business guy or whomever. We don't need to be white, black, union, non-union. We don't need to be all that. We need to just be West Virginians. Let's just keep pulling this rope together. We'll get through this, and we'll get through a lot of good stuff. But nevertheless, thank y'all so much.